All right. Is my voice audible? Give me a thumbs up if it is audible. All right. So guys, today's class, first of all, sorry for the delay. I had a hospital today, so just came an hour back. And regarding today's class, there will be nothing new to learn. Everything is like, you have to remember stuff today, like path, general farm, and public health science. Okay. Later, after the class is over, I'll share two PDFs in this group. In that PDF, there will be questions for the statistics, biostats, and ethics. Okay, and those PDFs are under the property of Melman Medical. So I'll share those PDF in the group, so you can solve those questions, and that's it. Like nothing extra needed to be done for biostats, ethics, general farm, and general path. Okay, so let's just start our discussion for the general path. Just a minute. I hope biochemistry and immuno are clear to everyone. Lots of questions were there and many concepts were there to remember. Okay, let's move to general path today. Micro we will do at the end. After today's class, we'll start with endocrine tomorrow. All right, pathology. So whenever we started our pathology subject, these were the basic stuff that we need to learn and that we did learn. This comes under the general path and that's all we are going to start today. So these are the basic cellular adaptations that you need to know. The most frequently asked question is metaplasia, and in atrophy they love to ask this part. Okay, so in atrophy they love to ask this part, that is in tissue mass, decrease in tissue mass due to decrease in size. Now, how size is decreased? That is by increase in cytoskeleton degradation via ubiquitin proteasome pathway and autophagy, decrease in protein synthesis. These are the two pathways. Just a minute. All right. Okay. So decrease in tissue mass due to decrease in size, increase in cytoskeleton degradation via ubiquitin proteasome pathway. This is first process, and the second one is autophagy. That is decrease in protein synthesis. Okay. So this is the question that they love to ask. And the second question that they love to ask is regarding metaplasia. The most favorite example becoming Barrett esophagus. Okay. So Barrett esophagus they love to ask, and atrophy. Rest all they are like in the UL there have been questions, but they are not asked frequently in NBMA or something like. Even then, let's just go through it once again. Left ventricular hypertrophy, that will be hypertrophy in the heart. So increasing structural proteins and organelles, increasing size of cells. Example, cardiac hypertrophy. If the cardiac muscle cells are increasing, it means it is undergoing hypertrophy. Hyperplasia, controlled proliferation of stem cells and differentiated cells, increasing number of cells, that is BPH, benign prostatic hyperplasia, and endometrial hyperplasia. Just remember the examples and you are good to go. Coming to dysplasia, disorder precancerous epithelial cell growth, not considered a true adaptive response. Okay, as we all know the basic rule, if all this fails, then it goes towards the dysplasia and it goes on increasing and increasing. Okay, and at the end, it leads to cancer development. Okay, that is the basic rule. Just remember the examples and you are good to go. Most commonly, they will be asking you atrophy and metaplasia. Okay, that's it from this. Now coming to cell injury, reversible and irreversible. Okay, here you need to remember the features, what are present in reversible and what are present in irreversible. So before going to this point, just look at this diagram. There will be membrane blabbing, there will be nuclear chromatin clumping. Okay, chromatin clumping is there, not nuclear clumping. Then cellular swelling, ribosomal detachment. So this is all a part of reversible injury. Now let's just see what they have given in the information over here. Decrease in ATP, decrease in activity of calcium and sodium potassium pump. As I told you, if there is any inflammation or any type of problem occurring in the body, the first thing that will be damaged is sodium potassium pump. Okay. So as a result of this, there will be cellular swelling. Okay, which is the earliest morphologic manifestation. This you need to remember. Cellular swelling. Okay. Ribosomal polysomal detachment, that is decrease in protein synthesis. As you know, ribosomes are attached to the rough endoplasmic reticulum and they help in protein synthesis. Moving ahead, plasma membrane changes, that is blabbing. We saw here what is blabbing. This is what blabbing is. Nuclear changes, that is just a chromatin clumping. Rapid loss of function, example, myocardial cells are non-contractile after 1 to 2 minutes of ischemia. Now, here they have given that the myocardial cells are non-contractile after 1 to 2 minutes of ischemia. Which cells will be non-functional in just seconds? So that will be neuron. Okay. So neuronal cells are very sensitive to ischemia. Okay, that's why we say कि कुछ भी हो जाए, whatever happens, there should be continuous supply of glucose and oxygen to the brain. Even if the supply is cut for just a few seconds, it will lead to ischemia and you might be brain dead or something like that. Okay, so this is all. That these are the features of reversible cell injury. One important point here is in NBME they asked was myelin figures. What are myelin figures? Aggregation of peroxidized lipid. Like this isn't there in UL, but in NBME this one question was there. Okay, myelin figure. So that's all for reversible cell injury. Moving ahead to irreversible cells. Breakdown of plasma membrane, cytosolic enzyme, leak outside of the cell. Influx of calcium, activation of degradative enzyme. Okay, here you can see increase in mitochondrial permeability. As you know, there will be leakage of enzymes, so we can say that permeability in the cell will be increased. Okay, the basic general path rule. Coming to mitochondrial damage and dysfunction, loss of electron transport chain, as a result, there will be loss of ATP. Okay, you don't need to remember each and everything what happens over here. Just remember the features. What will be the change in plasma membrane? What will be the change in nucleus? That's it. Okay, nothing else you need to remember. Rupture of lysosome, autolysis. It will start eating the old cells. Nuclear degradation. This is important here. Pycnosis, karyohexis, and karyolysis. This is important. Okay. So what is pycnosis, what is karyolysis, and what is karyolysis? Sometimes in the question, instead of using this word, they might give you the nucleus is condensed, the nucleus is fragmented, or the nucleus is dissolved. Okay. They will give you this word. So you don't need to get confused. Okay. That's it. So these are the features, and I consider this very, very high yield from the exam point of view. One or two questions might be asked from here. Reversible and irreversible. Okay. So remember these features. Yeah, does anyone know what is polysome? Anyone? Quickly tell me.
The mRNA, the ribosomes attached to the mRNA.
Not ribosomes attached to RNA and sorry RNA. I think it is a group of one or two ribosomes. Okay, so you can say cluster of ribosomes. Did you read it somewhere, Isha? Ribosome attached to
Just
mRNA.
previous knowledge.
Okay, okay. So if you came across this, just confirm it once. Okay, because even that is something like ribosomes attached to mRNA is something related to
Yeah, because
polysome.
I've
So
heard
just check it.
it in first year my biochem, so I remember that only.
Okay, so just check it and let me know because I am also confused. But I have written in
I've
my notes
googled
as
it.
cluster of
I've
ribosome.
googled it. I googled it
Mm-hmm.
and it says a cluster of ribosomes held together by a strand of messenger RNA, which
Oh, so
each is
yeah.
translated.
Yeah, yeah. So I think it's same thing only, right? So cluster of
Mm-hmm.
ribosomes attached by mRNA, you can say. Okay. So in polysomes, they gave one of the question in NBME. So instead of ribosome, they use the word polysome. So don't get confused. Both means the same thing when you consider the injury part. Okay. Moving ahead. Apoptosis. Okay, so in apoptosis, while we were studying for the university exams, we had two big cycles, intrinsic and extrinsic. Okay, so before going to intrinsic and extrinsic, let's just get to the general idea. It is ATP dependent program cell death. Intrinsic and extrinsic pathways, both pathways will activate caspases. Okay, and this will then go on and cause the irreversible injury. Okay, characterized by deeply eosinophilic cytoplasm. This is very high yield deeply eosinic cytoplasm. In the question, they will give you the cytoplasm was full of eosinophils. Tell me what process was undergoing. Answer is apoptosis. Okay. Basophilic nucleus is okay. Pycnosis cardiacis, so you have seen only earlier. Cell membrane typically remains intact without significant inflammation, unlike necrosis. Okay, in necrosis there might be blabbing or something like that, but in apoptosis, cell membrane will remain intact. DNA laddering, okay, you can avoid it. Okay, so these are the few points. Caspases, ATP dependent, eosinophilic cytoplasm, and cell membrane remains intact. These are the few points that you need to remember. Moving ahead, intrinsic pathway. So involved in tissue remodeling in embryogenesis, okay, occurs when a regulating factor is withdrawn from proliferating cell population, okay, also occurs after exposure to injurious stimuli. This is important over here. Occurs after exposure to injurious stimuli, example radiation, toxins, and hypoxia. Okay, this is the stimulus for the intrinsic pathway, that is the mitochondrial pathway. Now, regulation. Regulated by BCL2 family of protein. Backs and back up pro-apoptotic. It means it will be causing apoptosis. Okay, while BCL2 and BHEL are anti-apoptotic, it will be stopping apoptosis. So imbalance between both of them will lead to more and more cell death. Okay, so these proteins are pretty important. Again, you will be studying this in the hematology in the WBC cancer. Okay, so these proteins are important. You have to remember. So here they have given the mechanism. Backs and back form pores in the mitochondrial membrane. Release of cytochrome C. Cytochrome C becomes important here. Okay, and this is the release of cytochrome C is going to activate the cascade. Okay, so this is the process that you need to remember. Intrinsic pathway. Back BCL2 genes are responsible. Backs and back will cause release of cytochrome C. Cytochrome C will then cause the release of activation of caspases, and at the end it will go and cause the reversible or irreversible injury. Okay, this is what intrinsic pathway is. Coming to extrinsic pathway. In the extrinsic pathway, what is given is there are two processes, ligand receptor interaction and immune cells. So immune cell we already studied yesterday, CD8 plus T cells. Okay, so what they will be doing, they will release perforins and granzymes and they will uh, use it pseudopodia to like pseudopodia and engulf it. Okay, but ligand receptor interaction, what happens is fast ligand binding to fast CD95. You need to remember this. CD95 or TNF alpha binding to its receptor. Okay, so this is the main question that they will be asking you in intrinsic or extrinsic part. Okay, that's it. Okay, so this is the diagram that they have given over here. You can refer to it for the reference purpose. But if you are thorough with the information, I don't think anything else will be needed to you. Okay, so just focus on this information. Out of this information, they won't be asking any question. In the UL also, they have given the question based from this, and even in BME, the most frequently asked question was this BCL2 backs back. Frequently asked. And another in UL, they asked one question related to CD95. Okay, so just go to this question, the points again and again. Note this down. All right, let's move ahead. Necrosis, coming to different types of necrosis. And here they will ask you question, but the most commonly they ask is liquefactive. Okay, the liquefactive and gaseous being the most common. Coagulative they ask sometimes, but these two are the most common. And in liquefactive, they always go for either lungs or brain. Most common becoming the brain one. Okay, so let's just see what is important in liquefactive. Neutrophils release lysosomal enzyme that digest the tissue. This is very important. And the most important example is bacterial abscess. But at some part they have also given this in lungs. Okay, but the first option should always be brain. I am writing here brain, lungs. Okay, so brain is very important. The liquefactive necrosis in brain. How does it occur? Neutrophils release lysosomal enzyme that digest the tissue. Okay, you can ignore this. Coming to caseous part. In the caseous, if the person is suffering from tuberculosis or there is some systemic fungal infection, then think about cases. The most frequently they ask is tuberculosis. Okay, now tuberculosis and cases means there will be cheese like appearance. Okay, so as TB is there, the most important organ will be lung. So in the lung, they will give you the gross morphology, and in the lung there will be small uh, necrosis like that will be in white in color that looks like cottage cheese or paneer, and that is what known as caseous necrosis. Okay, how this occurs? Macrophage wall of the infective microorganism. So you know we are talking about TB. So yesterday we discussed IFN gamma and macrophage. They are what responsible for the pathophysiology in the tuberculosis. Okay, that's it. See, they have given already cheese like gross appearance. So either cheese like or cottage cheese like, they will use both of this term. Okay, so that's it for the necrosis part, but rest all are also a little bit important. So let's just go to them. Coagulative necrosis due to ischemia. There will be ischemia. Okay, so the most commonly asked question is kidney and liver. There will be wedge shaped infarct. Wedge shaped infarct. Okay, this is given in Robbins. It's not given over here. So just write it down. Wedge shaped infarct. So how it will be visible? If this is a liver, if this is a liver, so the wedge shape will be like this. Okay, the wedge shape will be like this, or it will be like this. Wedge shape. Okay, mostly they ask about liver. Moving to fat necrosis, enzymatic and non-enzymatic. Non-enzymatic is going to be traumatic. Enzymatic is acute pancreatitis. If they are talking about pancreatitis, the necrosis that you will be thinking about is fat necrosis. And here, what is occurring is there is saponification. This is the main word, saponification. Okay, saponification. So it will give appearance of chalky white appearance. Okay, pancreas hai, fat necrosis, chalky white appearance, saponification. That's it. Moving on to fibrinoid. The fibrinoid may there will be something related to artery. Atherosclerosis being the most common example. Okay, so immune complex deposition type 3 hypersensitivity reaction, plasma protein example fibrin leaks from the vessel. Okay, that's it. Just remember the atherosclerosis part when they are talking about fibrinoid necrosis. Moving to gangrenous. In gangrenous, one important point you need to note it down. If it is dry because of ischemia, it will be black and shrunken. If it is wet due to superinfection, it is going to be, oh sorry, yeah, it is going to be moist and foul smelling. Okay, so moist and foul smelling. So gangrene, you can easily it can be easily visible. And yeah, whenever we are studying pathology, no matter we are studying general or we are studying systemic pathology, always be thorough with the images. Okay, always be thorough, because 95% the images given in first aid is what appears under exam. Okay, so if your first aid images are clear in exam, you will be acing it. So that's it for the necrosis. Liquefactive and caseous being the most important. Rest all, just remember the examples. Moving ahead, ischemia, you can avoid this for now. You can avoid this for now. Coming to free radical injury. Okay, free radical injury, it damages the cells via membrane lipid peroxidation. The first important point that you need to remember, DNA breakage initiated by the radiation exposure. Radiation exposure is the second important point. Okay, and the next one is redox reaction, nitric oxide, all those stuff they have given, and metals, iron, copper, free radicals. So this is the third important point. So how does free radical injury occurs? These three are the reasons how this occurs. Okay. Now one important point, how these free radicals can be eliminated. So this is because of enzymes present inside the body, that is catalase, superoxide dismutase, and glutathione peroxidase. This is the fourth important point that you need to remember over here. And moving down, example, the most common example they will be asking is retinopathy of prematurity that occurs when the baby is premature. Okay, when the baby is premature and you give the baby oxygen treatment, and when you give the oxygen, it turns into toxicity, and it the first thing that is going to be caused is retinopathy of prematurity in the ophthalmology that you have studied as ROP. Okay, this is the most common example that they are going to ask, and the second most common example is carbon tetrachloride toxicity. Carbon tetrachloride toxicity. Okay, they will be asking you about it. So what all you need to remember here is, you need to remember the process of how free radical injury is occurring. Three process: membrane lipid peroxidation, radiation exposure, and third, free radicals, that is in the form of iron or metal, sorry, in the metal. Okay, free radicals can be eliminated by the three enzymes: catalase, superoxide dismutase, and glutathione peroxidase. Then the information coming to the example that they commonly ask. First one is ROP and the second one is carbon tetrachloride. Okay, so that's it. This I mark it as a high yield. Okay, moving ahead. You can ignore this, but one important thing that you need to remember here is acute radiation syndrome. It wasn't there in the 2020 edition, I think. Yeah, it wasn't there in the 2020 edition. So as the questions were asked in NBME and UL, they've added this section. Develops after sudden whole body exposure to high doses of ionizing radiation. Either it can be MRI or it can be X-ray. Okay, the body is immensely sensitive to X-ray or MRI, and as a result, you get these symptoms: nausea, vomiting, diarrhea, hair loss, all this stuff. Okay, so you might get this question. Okay, if it is not there in your edition, please note this down: acute radiation syndrome. It is not there in 2020 edition. I don't know about 21, but this is 2022 edition that I am using. All right, moving ahead for calcification. They have never asked calcification. They have never asked, but in order to be on the safer side, just remember dystrophic calcification tends to be localized and metastatic widespread. That's it. But they have never asked regarding calcification, so you don't need to do. Okay. Lipofuscin, they have asked a lot about this. Okay, they have asked a lot. A yellow brown wear and tear pigment associated with normal aging. Okay, so in the question, what they will be given is, yeah, in a normal question, what they will be given is a patient more than 60 or 70 years of age, then they will say that the patient died. Okay, the patient died. When you did the autopsy, and on the autopsy, when you were checking for the tissues, you found yellow brown pigment deposit. Yellow brown pigment deposit in the organ. Okay, most commonly in heart. Most commonly they will go for heart. Okay, this is the typical question that they are going to ask. And if it is yellow brown, think about lipofuscin. Okay, what is lipofuscin consist of? Instead of lipofuscin, they might twist it and ask you, this protein is composed of polymers of lipids and phospholipids complex with protein. Okay, so this line is also important. And the organs are heart, colon, liver, kidney, eye. Most common being heart. Okay. Moving ahead, amyloidosis. Amyloidosis is given in detail over here rather than with any other system. So let's just go through it. Basically, they don't ask individually about amyloidosis. They will always ask about the system. Nephrotic syndrome, then you have Alzheimer disease. Okay, so they will be asking you like this. They will never ask you alone separate amyloidosis. Okay, so see here they have given everything, the fibril protein and the common types. So primary one is from AL and secondary is from AA. This you need to remember, and rest all when you will be studying the systemic disease at that time we will be covering all of them. So let's not just waste time over here. We will do this. Just do primary and secondary amyloidosis. So seen in plasma cell disorders, this will be covering hematology. Okay. And secondary amyloidosis will be covering in chronic inflammatory conditions like rheumatoid arthritis, inflammatory bowel disease, familial Mediterranean fever. Okay. Yeah, guys. And before I forgot to tell you one important thing. Uh, General Pat, I would highly recommend you guys to do from Pathoma. Only the general path. Don't do the systemic path. If you have pathoma, like if you're having the exam in the next month and if you haven't touched pathoma, don't touch it. But if you have pathoma and if still there is time, do it from pathoma. Don't buy the subscription. If you have access to free resource, only then do it. Pathoma subscription is $100 for I think 3 months or 6 months, or I mean a year. I don't think you should buy it, but if you have, I would highly recommend to do first three chapters of Pathoma. That's very good and very interesting. But rest all part you can avoid from Pathoma because it is just higher stuff. He hasn't explained in detail everything. Okay, so I think we are done with the cellular injury part. Now let's move on to the inflammation part. No doubt in the injury part, topics to focus on was the reversible and irreversible changes, metaplasia. Then coming to the necrosis, you need to remember liquefactive and caseous. In the apoptosis, mostly the questions will be asked on BCL2 and back. And rest all was, I think, lipofuscin and free radical injury. Okay, so only 5 to 6 topics are there. Just do it. Nothing to understand. No need to apply brain during the exam. Just remember and answer it. Okay, coming to the inflammation. Response to eliminate the initial cause of cell injury to remove the necrotic cells and all this. They are not going to ask definition, so let's just skip it. Cardinal sign. They will ask cardinal sign. And the important point in the inflammation is they will be focusing more on mediators. See, in this edition, they didn't do the good thing. In 2020 edition, they separated the mechanism and mediators. Like they wrote the mechanism on one this side and mediators on another side. Let me check if there is a mediator. No, in this edition they haven't given the mediators. Okay, so what they do is in the exam or in the NBME, they will give you. You need to identify the cardinal sign. Okay, you just a minute. Okay. So in the exam or NBME, what you will be doing is you will be asked to identify the cardinal signs, and after identifying the cardinal signs, you will be asked what component or what protein or what mediators were responsible for causing this reaction. Okay, so let's just see what it means. Rubor and Keller means redness and warmth. So it will be vasodilation. As there will be vasodilation, there will be redness on the skin. This is the basic rule of general path. So how it is occurring? Mediated by histamine, prostaglandin, bradykinin, and nitrous oxide. This is what you need to remember. Histamine, prostaglandin, bradykinin, and nitrous oxide. These are the mediators that I am talking about. Okay. Moving to tumor, that is the swelling. Endothelial contraction or disruption, increase in vascular permeability, leakage of protein-rich fluid from post-capillary venule. This becomes very important. post capillary venule. Okay, they might ask you during the inflammation when there is increase in vascular permeability and the proteins are leaking out. From what structures the protein will leak out? Post capillary, pre capillary venule, post capillary arteriole, pre capillary arteriole. That is obviously not the logical choice because arteries will go into capillaries and then it will flow into the vein. Okay, so post capillary venule, one question was asked in NBME and one was asked in UL. Okay, so this post capillary venules become very important. And here the mediators are leukotriene, CD4, C4, D4, E4, histamine, and serotonin. You have to remember the mediators. Okay, those who have solved the UL, they must be knowing about this. Hmm. Moving on to dolor. Dolor means pain. Sensitization of sensory nerve ending mediated by bradykinin, PGE2, and histamine. Okay, so you have to pick out dolor and you have to pick out what mediators will be causing what cardinal sign. Okay, functional loss of function. That's it. So that's all for the cardinal sign. Moving to the systemic manifestation, that is acute phase reaction. So fever, as we saw yesterday, the fever was caused by IL-1 and TNF alpha. Okay, you remember IL-1 and TNF alpha. Okay, so let me just ask you one question. Uh, when you will select TNF alpha, any one of you, please tell me the answer.
Septic shock.
Yes. So along with the fever, when they have given the septic shock, only then you will select the TNF alpha. Rest all IL-1 should be the priority. Okay. Along with IL-1 and TNF, you will be having increase in prostaglandin E2. That will be causing fever. Okay. Another thing, increase in COX activity. Can anyone tell me what is COX? Anyone?
Oxygenase, which is
Yeah.
required for the production of prostaglandins and
Okay.
leukotrienes.
And okay. And another question, prostaglandins and leukotrienes are the derivatives of.
Arachidonic acid.
Yes, perfect, perfect, perfect. Okay, so that cycle that is given in Robin, just give a look. Questions not won't be asked, but just give a look. Okay, arachidonic acid metabolism. That is where you will be giving a look. Okay, that's it for fever. IL-1, TNF, increase in COX enzyme, and increase in prostaglandin E2. Okay, moving on to leukocytosis. In the leukocytosis, there will be increase in WBC count. Obviously, leukocytosis predominant cell depends on inciting agent or injury. For example, bacteria have the neutrophils. If there is a virus, then there will be increase in lymphocytes. Okay, and if there is TB bacteria, then there will be macrophages. Okay, plasma acute phase reactant. Serum concentration significantly change in response to. Okay, and yesterday we saw in the immunology IL-6 plasma acute phase reactant. Okay, so IL-6. Remember, IL-6 was also known as. Come on, anyone. IL-6 was also known as. What was it causing? Isha, bolo. Yeah.
It also causes fever.
फीवर ओके
Fever.
और कुछ भी करता था एनीथिंग एल्स
Acute phase reaction. Um,
yeah that will be mediated by the acute phase
Acute
reactant
phase proteins.
okay
Osteoporosis.
yes osteoporosis okay osteoporosis I was asking for
Osteoporosis and
okay
vertigo.
yeah and IL-1 can also cause osteoporosis because they are the osteoclast activating factors okay see you have to remember it okay I am saying if I am talking to you without looking at the information it means even you can do it okay so do whatever you want just remember those interleukins they are going to be very handy Acute phase reactants, these are some of the examples of acute phase reactants. Let's just quickly go through them. C reactive protein, opsonization. Okay, that's it. Ferritin, we'll be doing this in hematology when we discuss the iron metabolism. Fibrinogen, coagulation factor. Haptoglobin, again hematology. Hepcidin, again hematology. Procalcitonin, increase in bacterial infections, normal in viral infection. This is important. Okay, one question was asked in NBME regarding this. Okay, so this becomes important. Serum amyloid A, amyloid acid. So these are all the upregulating acute phase reactants. Okay, upregulating means they will be uh, in like regulating in the positive manner. Okay, coming to the negative down regulation, albumin reduction conserves amino acid. You could leave it. Transferrin again in hematology. Transthyretin reduction can okay again leave it. Okay, so just remember, sometimes what you will confuse with is in the exam they will give you this, and in the options they will be asking you what type of structure it is, whether it is polysaccharide, whether it is protein, whether it is acute phase reactant. So during that time you should know they are acute phase reactant. Okay, that's it. That's the only importance of acute phase reactant. And another thing is they are induced by IL-6. Okay, that's it over here. All right. Erythrocyte sedimentation rate. No need to remember anything. You must be knowing what is ESR. Okay. Whenever you see the lab values or whenever you see the reports of the patient, okay, reports of patient. So ESR will be increased. Okay. And what does ESR increase show? It means the inflammation is going in the body. Okay, inflammation is going in the body. Either your body is recovering, either your body is healing, or there is some active inflammation going inside the body. That what increase in ESR suggests. Even if you have seen the blood report of your family members or yourself, if there is some defect, you will be getting increase in ESR. Okay, that's all you need to remember, nothing else in ESR. Let's go towards the acute inflammation. You know, there are three types of inflammation: acute, chronic, and granulomatous inflammation. The first one being acute inflammation. In acute inflammation, transient and early response to injury. So first, how the body is going to act towards the inflammation is, act towards the injury is acute inflammation. Characterized by neutrophils. Okay, in acute inflammation, there will be neutrophils. In chronic, there will be lymphocytes. Okay, associated with edema. Rapid onset, short duration represents a reaction of innate immune system. Okay, just remember these 2 points: neutrophils and early response to injury. Just tell me one thing. If the like when the body tries to when the body is acting against the injury, what is the first thing that will occur? Can anyone tell me this? What is the first thing that is going to occur in your blood vessels? In the endothelial tissues के ऊपर जो blood vessels होते हैं, the endothelial capillaries, what is going to happen? Anyone, please.
Increase permeability of
Okay, if
endothelial cells
if it
of
increases the
yeah,
permeability of endothelial cells, then what will happen?
Leakage of the
edema,
fluid.
Again, go ahead. What will happen?
edema,
Before that, what will happen to the blood vessels? What will happen to the capillary? Will it dilate? Will it constrict? I'm asking that.
Dilation, basically.
Vasodilation.
da-
Vasodilation. Okay, but one point is given in Robbins. If you have read
Yeah,
Robbins,
the primary situation is vasoconstriction first.
yes. Okay, so this is very important. Vasodilation occurs secondary. Okay, first one is vasoconstriction, and then it will go towards vasodilation within a few seconds. Okay, so don't make this mistake. The first action on endothelial capillaries is vasoconstriction. and after that vasodilation occurs. You can go and check the Robin. Um in the inflammation part only they have explained it. In the like the diagram is given, and in the diagram the bubble is given. In that they have mentioned it. Okay, but you know in most of the questions, the first action on capillaries, most of the time they have given vasodilation. So, like I think it's a controversy in some books and in some not. Like I don't know, but in Robbins, as it is the standard textbook, so in that vasoconstriction is given. Okay, so just go through it one. Let's see the stimuli. Coming back to the acute inflammation, let's see the stimuli. So, infection, trauma, necrosis, and foreign bodies. These are the stimuli that will be causing acute inflammation. Moving ahead, mediators. See, this is the part where I would exclusively like you to study from pathoma, because in pathoma, Dr. Hussein has explained it so beautifully. All those receptors, okay, all those receptors, okay. So if you don't have the videos, download the pathoma PDF from Google or Telegram and just read the inflammation part. Okay, read the first three chapters of pathoma. Believe me, they are going to help you a lot. Okay, videos नहीं है कोई बात नहीं, read कर लो notes, काफी help करेंगे. Okay, so if you read that now, he has explained it in such a way that you will be remembering it for lifetime. For now, let's just see what are the mediators for acute inflammation. Toll-like receptors, arachidonic acid metabolites, neutrophils, eosinophils, mast cells, basophils, all those stuff. Okay. Inflammation. What is inflammation? Cytoplasmic protein complex that recognizes products of dead cells, microbial products, and crystals. Activation of iron. Okay, you can ignore this. Not needed. But one question was asked regarding inflammation in NBME. So it's up to you. But in UWorld, I haven't seen. And in even only just one question was asked. So you can just give a read. See, here also they have given component vasodilation. Okay, but first of all, there is contraction, because see, they have given up contraction of endothelial cells open up interendothelial junction. So obviously contraction हो रही है, पहले capillaries की contraction होगी, then it will open up, and then what is going to lead to dilation. Okay, they have given here, but even then they say vasodilation is occurring first. So this is what the controversy is occurring. Okay, so first, according to me, you can mark vasoconstriction, vasodilation later one. Okay, cellular part, there will be extravasation of leukocyte, mainly neutrophils, from post capillary venules. Another post capillary venules, accumulation of leukocyte and leukocyte activation. Okay, you need to remember this. So I'm highlighting you with the blue that you need to remember. Neutrophils, post capillary venules, and this vasoconstriction first and then vasodilation. Okay. Here, leukocyte activation has four steps: margination, enrolling, addition, transmigration, and migration. We'll be seeing this in the next page. Okay, we'll be seeing this in the next page. For now, just let's come here. Coming to the outcomes, resolution and healing. As we saw yesterday, IL-10 and TGF beta was the anti-inflammatory interleukin. Okay. Persistent acute inflammation, IL-8. Why IL-8? Can anyone tell me? Come on, quickly tell me why IL-8. Go back, see what was activated by IL-8. Come on, anyone? Okay, IL-8 was the activating factor for neutrophils. Do you remember? So in acute inflammation, neutrophils have a major role. So that's why we have IL-8. Am I correct? IL-8 has neutrophils. Yes or no? Show me thumbs up, please. Guys, am I audible? Okay, 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 okay. There will be abscess, as there will be edema formation. It might lead to abscess formation going ahead. Chronic inflammation, antigen present macrophages and CLC. Okay, leave this. And at the end, there is going to be scar formation. That is at the end of inflammation. Okay, not now. So here, till this, you need to remember. Okay. See, They have given here macrophages predominate in the late stage of acute inflammation. That is, the chronic inflammation is going to start now. Okay, but before that, we will be seeing the leukocyte activation, that it has the four steps. We will be seeing this and mark this as very, very, very high yield. Okay, what is high yield over here is all these components, all these chemicals. These are very important. In NBME and U world only, you will get so many questions. Okay, and in exam, I got one question related to PACAM. Okay, so this is very important. If you are not able to remember, take a printout, keep it in front of you. Okay, let's just see what they are talking. Margination and rolling, defective leukocyte adhesion deficiency type 2. Okay, E selectin, P selectin, CD34 and glycan 1. You need to remember this. Okay, that is, if you understand this concept, well and good. See, they have explained the concept over here, but in the exam, just concept explanation is not going to help you, because even if you understand the concept, you should know ki idhar kya hai, what is there over here. Okay, for that you have to memorize it. Moving to tight binding, that is addition. Defect in leukocyte addition deficiency type 1 decrease in CD18, we studied yesterday. Okay, we studied yesterday. Integrin, VLA4, LFA1. Yeah, without looking, quickly tell me uh, what are the symptoms? What are the clinical presentation? Quickly tell me. Come on, quickly. Bolo, bolo. LAD, immunodeficiency disorder.
So LAD may defect in migration of leukocytes, and then there'll be absence of pus, and uh, um,
Okay, tell me one thing. What will be the level of neutrophils?
like 20,000.
No. Like, will it increase or decrease?
Increase.
And neutrophils will increase.
Okay,
But not
and
certain 30 days.
Because
yeah,
It will
neutrophils.
be raised in blood.
Yeah, it will be increased in blood, but it won't go towards the site of action. The migration is defective. Okay. And one important point you are forgetting in the clinical part. Can anyone recollect it? The first clinical part given in first aid. Anyone? Anyone can recall it?
umbilical cord,
Yes. So sometimes,
if it were,
umbilical cord one, umbilical cord. So sometimes in the question they might just give you the umbilical cord case one, and you have to pick it out. Okay. So just try to recollect it like this. Okay. So here also ICAM1, VCAM1, CD54, CD106. I'm sorry, but you have to remember that. Okay. LFA1, LFA, LA4, integrin, all this stuff you need to remember. Coming to diapedesis, that is transmigration. WBC travels between endothelial cells and exit the blood vessel. PCAM1. This question I was asked in my exam. PCAM1. Okay. You might be also be asked. LF4 integrin part, it is given in NBME. Okay, so it suggests it is very important. Migration, chemotactic factor, C5A, IL8, LTB4, kallikrein, platelet activating factor, and various. So see guys, this is very important. All these factors are responsible for migration of neutrophils. Okay, all these factors are responsible for migration of neutrophil. They might not just tell you IL8, they might not just tell you C58, they might not just tell you LTB4. They can give you platelet activating factor. You don't have to confuse. Okay, and yeah, how the questions will be asked this, they will be asking what leukocyte was responsible for diapedesis of leukocyte activation. Okay, in the options they will give you PCAM1, LFA4, ICAM1, VCAM1, everything they will give you. Your answer you have to select PCAM1. Okay, so like this you have to remember that. So I'll mark this very, very high yield and difficult to memorize. So take a printout and check it or do whatever you want to. Okay, moving ahead. We come to chronic inflammation. After acute inflammation, there will be phase of chronic inflammation. So it is mononuclear infiltration, macrophage, lymphocytes, and plasma cells. There won't be neutrophils. No neutrophils. Okay. Now, in acute inflammation, the first type of action by body is occurring. Then it will be shifted to chronic inflammation. The hallmark that the chronic inflammation is occurring, or hallmark that the chronic inflammation has occurred, it that is fibrosis. Fibrosis, or you can say scar formation. Okay, so if in a myocardial infarction, okay, in a myocardial infarction, they say there is a hypertrophic scar formation. It means chronic inflammation has already occurred, and that part is not going to regenerate again in the heart. Okay, that part of heart is lost. Okay, so whenever you study about the systemic pathology and you hear these basic terms like scar formation, or you find neutrophils, you find macrophages. See, because in myocardial infection, they ask within the 1 to 7 days, within 7 to 14 days, they will be asking what type of cells will be predominating. Okay, so you should think that the acute inflammation is going on to neutrophil. Chronic inflammation, fine. Just keep this thing behind. Okay, that's a stimuli is maybe because of infection or type 4 hypersensitivity or foreign material toxicity. Okay, we did this yesterday. TH1 and TH2. If you remember, TH1 is activated by, I think, uh, IL-12 and IFN gamma, and TH2 is activated by IL-4 and IL. What was the second one? IL-13, I guess. I don't remember the second one. Okay, so this we already studied yesterday. No need to again go through now. Yeah, another thing. Now, when you talk about the wound healing, when the question is talking about the wound healing, they will ask you, they will just give you one line. Blood vessels are regenerating. Okay, and the fancy term for it is angiogenesis. So now instead of angiogenesis, they will be giving the blood vessels are regenerating, and in the options they will be giving what is responsible for angiogenesis. So FGF, TGF beta, VEGF. Among this, VEGF becoming the most important because the full form of vascular endothelial growth factor. I hope you got the question. This is the question. In the end of a question, they will give you this line, or they will say angiogenesis has occurred. Okay. So PDGF, activated platelets and macrophages. We know another function of PDGF is stimulates neutrophils. Okay, we saw in the last slide. Metalloproteinases, tissue remodeling, EGF, growth, cell growth. Okay, so these are important. One important point I wanted to write here. Okay, see, if you have done from pathoma, there is one important concept here. First intention wound healing. First intention wound healing. This is mostly the surgical wound. These are the small wounds. Okay. In this, there will be epithelial regeneration. Okay. There will be epithelial regeneration. And second intention is large wound. Okay. Now in the question, they will be giving you during the surgery, a small incision was left open. So that is what surgical wound healing. The wound healing will be occurring by first intention. Okay, so like this, this was taught in pathoma, and one or somewhere in UL, I think this question was there. Okay, moving ahead. Phase of wound healing up to 3 days after wound, after 3 days, and 1 week, 6+ months. Okay, so this is important because here they will be asking what are the effector cells present. So up to 3 days, platelets, neutrophils, and macrophages. It means still the inflammation is in the acute phase. Okay, starting initially it will be in the acute, then it will go to chronic, and then wound healing will occur. Okay, so up to 3 days, acute inflammation must be completing. So neutrophils will be present. What happens here? Clot formation, vessel permeability increase, neutrophil migration, and all those stuff. After 3 days, there will be chronic inflammation. So fibroblast, myofibroblast, because I told you, whenever there is a chronic inflammation, this fibroblast will be causing fibrosis. Okay, So deposition of granulation tissue and type 3 collagen and angiogenesis and all those stuff will come into play over here. Okay. And remodeling. It means after the chronic inflammation has finished and now there is a scarring or healing. So here fibroblast will play the major role. Type 3 collagen replaced by type 1 collagen. This is very important. Type 3 gets replaced by type 1. Okay. And if there is a zinc deficiency in the body, there will be delayed mobility. So this is how the chronic inflammation part becomes very important. Okay, you just have to keep in mind all these basic stuff. This is not something you need to memorize. Okay, this is something it should be in you. Like if in basic mathematics we do, if plus sign is there, so you know what we need to do. Similarly, like this, general path, you should read and you should get it by naturally. Okay, that's it for chronic inflammation. Note this down. I think the last topic of inflammation, granulomatous inflammation, and then we'll move to neoplasia. Nothing is there in neoplasia. Okay, guys, so this week there will be no class on Thursday and Friday. Okay, Thursday, Friday there will be no class, but tomorrow, Saturday, Sunday I'll be taking. Okay, because Thursday, Friday I'll be little busy and won't be able to conduct. Okay, so you can plan it accordingly from this. All right, moving ahead. Granulomatous inflammation. They basically don't ask any particular question from here. Uh, can you give me some examples where granulomatous inflammation occur? Examples of disease. Anyone? Quickly, one, two examples. Come on, anyone?
Tuberculosis,
Okay. Second,
sarcoidosis,
perfect. So these two examples, this is what I am looking for. TB and sarcoidosis. Okay. Another thing, another example. Can anyone tell me? IBD, it is a form of IBD.
Crohn's
Yeah.
disease.
Hmm. So these are the most common form of granulomatous inflammation that they usually ask. Now, only one thing that you need to remember here is granulomatous inflammation is mediated by IL-12 and IFN gamma, and remind and mark this. So many UL questions are there. So many. Okay. They have tried to ask it with tuberculosis. They have tried to ask it with sarcoidosis. They have tried to ask it with Crohn's disease. So many questions. So it becomes pretty important. Just IL-12 and IFN gamma, granulomatous inflammation. And you know there are two types, caseating and non-caseating. Okay, in caseating there will be central necrosis, whereas in non-caseating there will be no cancer. And for this also you need to remember the example. In Crohn's disease there is non-caseating. Okay, in TB there is caseating. Sarcoidosis, non-caseating. Okay, so this is all that you need to remember for granulomatous inflammation. This point, this is very important. Sorry, IL-12 and IFN gamma. This is very important. Just lock it in your mind. So many questions have been asked, even in NBMEs, even in UL. So this is for sure going to come. Here the examples have already given. You can look at them. Coming to the last part of our inflammation part, we have the scar formation, hypertrophic scar, and keloid scar. I think one question is there in UL regarding keloid. Remaining, they haven't asked any question. So you can just see type 1 and type 3 collagen. Incident with darker skin. That's it. That's it. Okay, keloid. So you can see this image. This image will only be given to you in the exam. Okay. So with this, we are done with the inflammation part of pathology. Coming to the last part, that is the neoplasia. In neoplasia, basically, you don't have to learn anything because neoplasia is talking about the tumor. And when you are studying the systemic pathology, when you are studying the systems, you are already learning the tumors, the genes, and everything. Okay, so neoplasia as a separate topic, it's there is no logic to read and revise it also. Okay, only two three topics you need to revise. Let's just discuss that. Yeah. So they might ask you this question: dysplasia, carcinoma in situ, invasive carcinoma. What is the difference in the definition? Loss of uniformity in cell size, loss of tissue orientation, nuclear changes increases, all those stuff come under dysplasia. In carcinoma in situ, involves the entire thickness of epithelium but does not penetrate the intact basement membrane. You can see over here already. This is what invasive carcinoma, sorry, carcinoma in situ is. Cells have invaded basement membrane. Cell-cell contact lost by activation of E category. So see, this basement membrane has been broken down. And the most commonly, they ask this type of question in cervical intraepithelial neoplasia. Okay, that will be doing it in reproductive pathology, or you have done it in obstetrics and gynecology. Okay, so this is one important concept that you need to remember here. Second important is you should be familiar with the term. Okay, these are all the general knowledge stuff. Okay, grading and staging. What is actually grading and what is actually staging? They have asked in the exam. So let's just see. Degree of cell differentiation and mitotic activity, that is grading. Okay, and staging means degree of invasion and spread from initial site. Okay, so this is the difference that you need to remember, and they have asked this question in the exam. All right, that's it. Moving ahead, you can actually avoid this. Okay, you can actually avoid this. No need to do. Here they have asked one question in NBME. CTLA4 on T cells outcompetes CD28 for B7 on APC is loss of T cell co-stimulatory signal inhibited by CTLA4. This is the drug name. So this is very important. Just remember this line. Okay. Actually read this whole interaction between PD1 and PD8. This is also important. They ask this also in NBME. So this is important. Just read this. It is just a sort of mechanism for drug. Okay. And extremely high yield. This point. Cancer incidence and cancer mortality. They will sometimes show you the graph. They will sometimes show you the bar charts. They will sometimes show you the pie charts. They might sometimes show you the this uh like like this. They will show you something like this. And the most frequently asked question is, what is the most common cancer in males? Most common cancer in females. This too. And then they will ask you what type of cancer is responsible for high mortality in males and females. So this is very, very, very high yield, and for sure they are going to ask you. Okay, I think 3 to 4 NBMEs has this question, and even you will answer. So make sure you know this properly. Common metastasis you can avoid. You will be already doing this with the systemic pathology. Yeah, these are the genes that you will be doing in the systemic pathology, but I'll just mark down for you which are important. Ret is important, BCR ABL important, JAK2 important, C-KIT important, KRAS important, here APC important, this important, P10, RB1, T53. See, all those are important because you will be getting them in various disease studying in the system wide. Okay, now how they will be asking you question over here is, for example, let's take this as an example. They will give you the case of either of these cancers, colorectal, pancreatic, or lung. At the end, they will tell you a gene is responsible for this cancer to occur. Okay, they won't tell you whether it is KRAS or something else. Okay, you have to identify the gene on yourself by yourself. After identify the gene, they will tell the gene product, which gene product was responsible for then your answer will be RAH GTPH. This is how they are going to ask you. Okay, so in one question you got the two questions. Okay, so this is how they are going to ask you. So this is also difficult to remember. Take out the printout, check it in front of you. Okay, you have to do it because when I used to prepare, I had around 25 to 30 images of printout on my wall. Okay, carcinogen, just give a read. You will be doing them in the system as well. Okay, that's why neoplasia, become very, very less important to study. All this you will be doing. All this you will be doing. So no need. This also you will be doing. Some more bodies also you will be seeing in various disease. Okay, and avoid this paraneoplastic. Don't mug up the useless information. Don't mug up the unnecessary information. Okay, see, symptoms and syndrome, it will be better if you learn system wise so that you remember I studied this syndrome in this system rather than just studying it together in neoplasia. Okay, yeah, and this is something new that they have added in this edition. I think 2021 edition also has this. I'm not sure, but 2020 wasn't there. And believe me, there are so many questions in UL and in NBME also. Okay, so many questions. Whether it was not in BNB, it wasn't there in first aid 2020, but in UL and NBME, so many questions regarding aging were there. Okay, so in this, cardiovascular becomes the utmost importance, very high yield. Second, hematopoietic. Third, immune. Fourth will be nervous system. Fifth will be skin, reproductive, and respiratory. So almost everything. Okay, and they have questions for each and every system. Okay, to do this properly. With this, we are done with the path. Take a 2 minutes break, and we'll start with okay, we will go with public health science first because in that we'll be covering more topics. Pharma is again, same like path. Just see what is given and learn it. Same is the case with the public health science, but the topics are more biostats, epidemiology, and all those stuff. So we will finish that faster. We just take a 2 minute break and we'll start with public health science. All right, Pooja, do one thing. After class gets over, just text me in the group or text me personally. I'll send you.
Okay, sure.
Okay,
Yeah.
I'll send you.
Okay.
Even in my edition, it wasn't given. They have updated it from
Yeah, it's
2022, I
in.
think.
Yes, it's not there in
Okay.
2021. Although like I have seen a lot of questions on
Mm-hmm.
UWorld
Hmm.
regarding normal aging, and I have made notes also. But
Yeah,
like this is given like in much more detail and
yeah. Yeah. No worries. I'll send you. Just remind me after the class. Okay.
okay, thank you. Yeah,
Yeah.
sure.
All right, guys. Then let's start. I'm very tired today. Okay. Let's start with the public health science. First one is epidemiology. Okay, and I think you must be having confusion with this. Your questions might be getting wrong. No worries, even my questions were getting wrong. You need to pick out the pattern from the UL. Okay, UL से pattern पकाओ. Okay, if you get that pattern, how they are saying it is cross sectional, how they are saying it is case series, you will master it. Okay, in the starting, they are going to get wrong. Okay, so just start. Case series describes several individual patients with same diagnosis, treatment, or outcome. Okay, you have to just stick to your definition. Okay, if you stick to your definition, then the case that they are presenting it, they are playing with your English. Okay, nothing else they are doing, they are just playing with your English. All right, cross sectional frequency of disease and frequency of risk related factors. Question they have given, what is happening here? Important point, just note it down. From the cross sectional study, prevalence can be calculated. Prevalence can be calculated. Just note this down. I have written it from NBME or UL, I don't know. So, and I think most of you are Indian students only. And if you have studied PSM, I think this is going to be a cakewalk for you. Okay. Moving ahead to case control. Retrospectively compare group of people with disease to group without disease. Okay. Look to see if odds of prior exposure or risk factor differs by disease state. What happened? Question here is what happened. So in case control, you will be asked for a calculation of odds ratio. Okay. Whereas in cohort study, you will be asked for a calculation of relative risk. This is how you should remember. If they are talking about odds ratio, case control. If they are talking about relative risk, cohort study. Okay. Let's just see. Compares a group with a given exposure or risk factor to a group without such exposure. Okay. In a case control, group with a disease, group without a disease. In cohort, group with a disease with some exposure. And in group with a disease without their exposure. Okay, this is the minute differences that they are getting. Don't worry, I'll share the PDF of questions and you solve that. You will enjoy solving it. Okay, and you will be good enough to go. Twin concordance study. Compare the frequency with which both monozygotic twins versus both digotic. In the case they are giving twins, close your eye and go for twin concordance study. Adoption study. Adoption study compares siblings raised by biological or adoptive parents. Ecological study, many questions have been asked. I got one in NBME and another was in my real exam. Ecological study compares frequency of disease and frequency of disease across population. So in this question, what question I got was, yeah, you are a researcher and you want to check about the COPD patient or any particular disease patient in you can give any name of an area. Okay, for example, in Mumbai there is area Borivali. Okay, so in a particular area, so if there is a particular area you are talking about, the that record is only provided by the health department of our government, and only the government can provide you with the details through hospitals. Okay, so this is how the ecological study is going to ask. Another thing, sometimes not only in a locality, not only in an area, they might also ask about a country or a particular geographical location. Okay, so make sure you know that. And here they have totally summarized it. If it is a cross section, you have to look for a risk factor, present or not present. Compare the risk factor, that is case control. Retrospective cohort study and prospective cohort study. Okay, so this is how you will be identify each and every stuff. I just told you what is important, what is not important, how to identify and how to distinguish. That's your job, and that's based on the level of English that you will be applying in the question based on your understanding. Okay, that's it from this page. Going ahead, clinical trial. In a clinical trial, this part wasn't there in the 2020 edition. I don't know about 2021, but they have added it over here. Why? Because intention to treat analysis, crossover clinical trial, and per protocol analysis. Just remember the definition, what they are trying to say. Okay, just read the definition, and the same definition will be asked in the question. Okay, same definition. So just read this definition and you are good to go. Another thing in the clinical trial, phase, all the phases are important. Let's just see how they will be asking you. Very small number of either healthy volunteers or patients with disease of interest. Okay, phase 0 is the new phase that they have added in this first stage. In 2020, phase 0 wasn't added. Coming to the phase 1, small number of either healthy volunteers or patients with disease of interest. Okay, safety assessment via dose escalation determines the maximum tolerated dose. All dose that I'm underlining, that is important. Okay, moderate number of patients with disease of interest. Efficacy assessment, will it work? Third, large number of patients with disease of interest. Effective assessment via comparison. Any improvement is needed or not? That one. Phase 4, post-marketing surveillance of patient. Provide data on long term. Should it stay in the market or it should be withdrawn? Okay. So this is very high yield, I would consider. And every time you will be confused in phase 2 and phase 3. You will be confused in the market. Okay. So make sure you are thorough with this. This is something new, wasn't there in the 2020 edition or 2021, I don't know. So you can avoid it. And I haven't seen Bradford Hill criteria before in NBME or even in UWorld. Okay. I don't know about the updated versions of UWorld. If you have seen it, please stop me there and okay, just tell me my mistake if I am wrong somewhere. Quantifying risk. This entire page, you should by heart. Okay. Just the formula, odds ratio formula, relative risk formula, relative risk reduction formula, absolute attributable risk formula, absolute risk reduction plus number needed to treat and number needed to harm are also asked. Okay, formula. Case fatality rate is also asked. All the questions will be there in NBME, at least one. All the questions. So what you need to do is, if you are confused how to use them, read this example. If you are still confused how to use them, I'll be sharing you one PDF. In that, the questions are there, solutions are there. Just go through it and you are good to go. On the other end, you have UL. In the UL, there is number needed to treat and number needed to harm. Even in NBME, this is asked. Okay? So make sure you are thorough with the terms and the formula. Mark my words, you are going to get one calculation in the exam, at least one calculation. What I got in the exam was calculation of mean, median, and mode. And the problem that I faced while calculation was they give me a data of 40 variables. Now I have to align them in the ascending order and then I have to calculate it. Okay, the problem was the calculator was on the PC and that is a very small calculator. So you have to see it properly. The mouse that is given, with the help of a mouse, you have to still whether you are clicking on 4 or whether you are clicking on 3. So small calculator. Okay. So even in the UL or NBME, the calculator that they are providing is pretty big, but try to practice from that only. Okay, don't they will provide you with the paper or cardboard and a marker and duster, but it will take a lot of time. I took 5 minutes to calculate this. Okay, because the 40 variables were there and I have to arrange them in the ascending or descending order. Okay, so be prepared and yeah, don't leave these questions. These are going to be for sure mark boosters. Okay, so just remember the formulas and what already asked. Another thing, just a minute. Okay. This this wasn't given in 2020 edition, and so many questions are there in UWorld as well as NBME. So high yield. Okay, you see this type of charts will be given to you. Basically, this type will be given. Okay, you and they the questions directly. Direct questions will be asked. Okay, so don't make any mistake here. Pooja, I this was given in the 2021 edition.
No, no, it's not
Yeah.
given.
So I think 2020 and 2021 are following together. 2022 is the new edition. So this wasn't given in 2020 as well. But there are so many questions. I think you must have faced this question, Pooja, right?
Yes, I actually printed it out from UWorld.
Yeah, yeah,
Um,
yeah,
because
yeah.
so
So
yeah.
no worries, no worries. So 2022 has so many changes. Okay. So just go through it. Just ratify this. Direct questions have been asked. You will be shown this pyramid and you will be asked the question from this. Okay. Skip likelihood ratio. It's okay. Kaplan Mayer's curve. I think that's a different way. You can skip this. This is also not given before and it haven't been asked. Give me a minute. Okay, you can skip this. Evaluation of diagnostic tests. Another important. This is also they are going to ask. Okay, calculation part. Totally calculation part. Okay, and I used to get confused by solving this question. Like what is true positive, what is true negative, what to put where. I was literally confused. But still at the end, I solved many questions and managed to do it. Okay. So this is for sure going to come. You will get one question definitely. Remember the sensitivity formula, specificity formula. Remember this placement also, true positive, false negative, all this stuff. Okay, remember this properly, right? This is very important. And one important thing over here is yeah, in the PPV, this is the PPV value. Okay, so PPV value, if PPV value increase, prevalence will increase, and if NPV value increase, prevalence will decrease. Okay, even this box is important. Even this diagram is important. Each and everything over here is very important. Okay, this page I will literally mark you high yield. Okay, so whatever you want to do, ratify it, solve more questions, whatever you want to do. These 2 3 pages in epidemiology, they are very important. Okay, ROC curve. One question was there in NBME. Okay, so this is the line. The curve is flipped, lowering the false positive and all this stuff. Remember all this. In UWorld also, I think one question is there. Okay, so this is what I was talking about for today's class. There is nothing to understand for today's class. I will just mark you what is important, what is not important. And so in this page, everything is important. Everything. You will be confused here also. You will be confused here also. So hello, I was disconnected. Hello, am I there? Am I there?
Yeah, I
I
can
was
hear you.
disconnected in the middle.
Mm, yes,
Okay, no
now it's
worries.
on.
So yeah, so that's what I was saying. Just you have to remember the stuff over here. Moving ahead, precision versus accuracy. Again, very important. They have asked questions. They have asked questions. So just remember the diagram. If you remember the diagram, you are good to go. What is actually the concept over here? Okay, just remember them. Questions have been asked. Incidence versus prevalence. The most important part is the calculation part, and the second, high yield, high yield, high yield. Very high yield. Directly they have given the question. Incidence is in like if these are the factors, what will be the effect on incidence? What will be the factors on prevalence? And they will be asking you both in the one question only. In the options, they will tell you Incidence increases, prevalence decreases, incidence decreases, prevalence increases, no change in incidence, no change in prevalence. Okay, so this all are very, very high yield stuff. Okay, let me see one important point I wanted to. Yeah, Pooja, you can mention this. New effective treatment started. This is not given in 2020. Increase in diagnostic sensitivity is not given. Decrease in contact, this is not given. This is not given. So just take a screenshot here so that you don't forget at the end what you else need. Okay. All right. Apart from Puja, those who are using 2021 edition, for them also, please take it. Bias. Now another important thing is bias. Most commonly, they will be asking you about selection bias, measurement bias, observer expectancy bias, and recall bias. No, recall bias they won't ask. Procedure bias. Okay, so these four bias they love to ask very commonly. Okay, so I think bias is just about the definition, reading the definition, and then picking out from the example. Okay, more and more questions you will solve, more and more you are going to ace it. Okay, this is all about the theory. Okay, there is nothing like nothing extra topic you are learning over here. Everything is about theory. If your theory is good, if your understanding capability is good, you're good to go in the exam. Okay, so we are not discussing anything over here, just learn about the bias deficiency. So I think they have started biostats over here. Okay, coming to the biostatistics, what else you need to remember here is obviously mean median mode. Just see the normal distribution. This 68%, 95%, 99.7%. This is another calculation part. Okay, the variance and all those stuff they will be giving you, and this is again another calculation part. Non-normal distribution, what will increase in positive skew, what is decrease in negative skew. So all these are very, very high yield. I'll give this page also high yield. Everything, basically everything in PHS is high yield. Okay, just wait, we haven't come towards the ethics. What if I tell you every block will have four ethic questions? Every block, total 7 blocks. Every block is going to have four ethic questions. Okay, and out of the four ethic questions, two you will solve it, and remaining two it will be Jai Mata Di. Okay, because those remaining two you haven't studied about that situation nowhere. Neither in BNB, neither in NBME, neither in UL, nowhere. Okay, so you just have to do Jai Matari and you just have to be a good person. Think that you are a good person while solving the ethics question. Okay, so we'll come to that. Each block is going to have ethics question. So see, like you are already taking risk over here. Two questions you are taking a risk. So it's better you don't take a risk somewhere else. Okay, I hope you got my point. In order to pass, you should at least get I think 32 questions at least correct. Okay, only then you will be safely passed out of 40. Okay, yeah, and this was the concept that I left because I wasn't able to solve the question. Okay, I wasn't able to solve the questions, and sorry to announce that I won't be explaining this stuff because I didn't understand this. I left this topic. Okay, I left this topic and I left pedigree topic. So if you guys understand this, one question is for sure going to come regarding this error and null hypothesis. Okay, for sure this is going to come, but I am keeping it here because I didn't understand up till now. Okay, so if your concept regarding this is strong, you are going to get it. Okay, every NBME has one or two questions regarding this. Even the UL has so many questions regarding this, so you can just go to them and solve it. Okay, coming now here, confidence interval for 95% and 99% you will be asked to calculate. Now, common statistical test. Okay, so you for this you can just refer this flow chart. Very easy. Okay, this is the part where I enjoy. This is going to be very easy. Just see how many variables are to be compared. If it is numerical, if it is categorical. If it is numerical, two groups, greater than three groups, you have t-test and ANOVA. If it is categorical, small sample or large sample, features and scratch. Okay, this is very helpful and this is going to be easy. Okay, don't worry about it. See, the examples have also been given here. So the main part over here was that I felt difficult was null hypothesis and the power and error part. Okay, rest all is just you have to remember the formulas, keep solving more and more questions, and you will be familiar with it. Just before the day of exam, if you want to revise anything, just revise biostats epidemio. Okay, biostats and epidemio is must because it's total mathematical base. You have to keep revising the formula. Rest all, don't revise anything on a day before the exam, but revise this too because there are so many formulas. Okay, move ahead. Pearson correlation coefficient. Just see what it is. Minus negative, slow, slow, slow. It is going on. Just understand how the dots are placed, and you are good to go. Okay. So with this, I think we are done with the biostats and epidemic. Okay. See, I told you, no new concept, nothing is new. Whatever is given in first aid, just make sure you know it on the tip of your fingers. Okay. That's it. That's it. Nothing else you need to remember. Okay. Moving on to the ethics. Moving on to the ethics. Autonomy, they will be asking you, and beneficence, they will be asking you. They will give you a case, and then they will ask you what ethical principle is violated here, or what ethical principle did the physician follow. Okay, so here they will come autonomy and beneficence. These are most commonly asked. Decision making capacity. When you know how the decision making capacity will be given is either the patient will be less than 14 or 15 years of age or maybe 18 years of age, then the patient might be having some neurological problem, so he might not be able to make the decision. So in this condition, the physician has the upper hand whether the treatment should be given or not. One important point. Yeah, in one of the questions they gave that this intellectual disability, or you can say the competency, okay, competency of a patient. Who determines this competency? Who determines? Answer most of the time, you will be selecting as a judge. Okay, no, answer is not judge. It is the physician who will be determining. Okay, so one question was asked in NBME. Judge has no right to determine the competency. Physicians will be determining the competency of a patient. Okay, second thing, they have given completely less over here. See, they have already mentioned here, but in the old book they haven't mentioned this. So many new changes in 2022 edition. Okay, so just write this down, nothing else. Informed consent. Now, whatever the procedures you do, you must have seen in your internship or wherever you are doing job, consent is necessary. Okay, consent is necessary. So let's just see disclosure, understanding, capacity, and voluntariness. So they might give you a question uh, before you perform any procedure. Consent is required. So they will ask you silly question. Consent from the doctor is required. Consent from the family member is required. Consent from the ethics board is required, or consent from the patient is required. So only thing is consent from the patient is required. Okay. If the patient is not thinking straight, if the patient is not competent to make this decision, then we will be having this what do we say, power of attorney. Okay, it means from the patient, if the patient is not able to make the decision, then the power of attorney has the right to make the decision for the patient. Okay, so this is what all the ethics is going to play you, and you have to be a good person. That's it. Just make one clear goal. You have to be a good person. That's it. Okay. Consent for minors. This is also important. Less than 18 years of old. All these are the categories where consent is not required from the parents. Okay. In other cases, consent is required from the parents if a minor is coming to your clinic or hospital. Okay. But in these cases, consent is not required. They can directly come and you are obliged to treat them. Okay. Advance directive. So these are some types of power of attorney that the patient will be giving to the like his next generation or his power of attorney. Okay, it can be any form. It can be oral advance, like the patient has said to the family member or someone else. Written advance. There is a written proof. Medical power of attorney. Okay, so apart from the family member, the patient has made someone else, made patient has made the ethics committee, the officer in the ethics committee responsible to take the decision. Okay, and do not resuscitate order. Questions have been asked on this also. They will give you a big case, and for example, you are the daughter of your, you are the daughter of the patient, but the patient was registered in the government record ki she is DNR. DNR is do not resuscitate. What you will do? Will you follow daughter's advice or you will go with DNR? Answer is you will go with DNR. The DNR decision is very important. Okay, so all this stuff, just give it a read. Ethics is just about reading and being a good person. Same goes for ventilator assisted life support. If the patient has already said no DNR, no ventilator support, you will not give the ventilator support. You won't listen to any family member. You will remove the patient from ventilator. Okay. If the patient said yes, ventilator support is necessary. If he has said this to the his power of attorney or someone else, then you should listen to them along with the proof. Okay. And here they have asked surrogate decision maker, you need to remember this order. Priority: spouse, adult children, parents, adult sibling. Okay? This you need to remember. Confidentiality, you are not allowed to talk about your patient in front of anyone. Okay? In front of anyone apart from your colleagues who are assisting on on this case. Another thing, these are the examples where confidentiality can be exempted. Okay, like abuse, or there is some pandemic like COVID-19 was there, so you can't just say because of confidentiality we won't share your disease. You have to report it to the public health center. Okay, so these are the things that you need to do in ethics. Accepting gifts from patients. Okay, like they have said that a small gift can be allowed. I think they have even given the amount. What was the amount? Does anyone know the amount? Anyone knows the amount?
I think it
I
was
think
in UWorld, it was mentioned less than $100.
yeah, $100, $100. So physician can accept gifts, can accept gifts which are less than $100. Okay, like there are so many questions in New World and NBME. The patient is very happy that you have treated him properly, and now the patient is offering you 2 seats for any concert. Okay, 2 tickets for a concert or 2 tickets for the NBA game or something like that. Now those tickets are expensive. They are not of $100. They are more than $100. Okay, so like these questions will be asked. If it is more than $100, then they will ask you, what will be your response? So politely say them, this is not allowed. Politely reject them. Okay, don't make them feel bad. This is all being about a good person. I really enjoy solving ethics questions. Okay. This was given in U World, but not in first aid. Okay, they have not. This was not given in the old edition. I remember this because I too wrote down from the U World. This you can avoid. Like, not avoid, but don't avoid. You will have this question. Okay, just basic English. Delivering bad news. All this stuff, these are all the new updates in the first day 2022. Nothing is there in 20 and 2021, but you will had the question, and that's why they have updated it. Okay, gender and sexuality inclusive. It is also not. I think this was also not there in 2022. This was also not there. So all these are new added things. So just give a read. If you read all this, I think the UL questions won't be wrong. This is all in the 2022 edition. Okay. I think we are done with ethics also. Yeah, use of interpreters. So many questions have been asked in interpreters. Okay. So in this, the most common question they will be coming is patient comes with friend or relative, and for example, you are in US and the patient came from France and he can only understand French, but relative knows both English and French. What will you do? This is the answer. You won't rely on relative. You will tell the patient or you will tell the relative to wait till the board recognize translator comes. Okay, and this board recognized translator can be in person or it can be via virtual call. Okay, virtual live call, it can be anything. Second thing, you are a physician. Okay, your patient is from France, but patient can only understand French, but you took French classes in high school and you can communicate little bit in French. Even then you are not allowed to communicate with the patient in French. You have to wait for board certified translator. Okay, you don't have to use your knowledge. Okay, you can speak few sentences to comfort the patient, but you can't take the history. You can't use the medical terms and diagnosis and all those stuff with just a small amount of knowledge of French. Okay, translator is must. Use of interpreters, this is what we were talking about. And communicating with the patients of disability, it means, if a patient is not able to speak, if a patient is not able to hear, it is your duty to make him understand by any means. Okay, it can be by showing him a video, it can be by writing. If the patient is not able to hear, it can be by writing, by video. You can call for another interpreter who knows sign languages. Okay, see all these questions they are going to ask, all these questions, and believe me, all cases of ethics will be covered in your exam, all cases, because each block is going to have 4 questions of ethics. Okay, so ethics play a major role in your passing. And see, this is all the examples, these are all the scenarios. Just give them a read. You will definitely come to it. Okay. Disease prevention is also important. They will just give you the examples, read these examples, and then they will ask you it is primary, secondary, or tertiary treatment. You can avoid this medical insurance plan. You can avoid this healthcare payment bundles, Medicare and Medicaid. This is again important. You will be asked difference between Medicare and Medicaid. Okay, and one question will be there. You can see here in Medicaid, sorry, in Medicare only, about a 65 years old, and if the patient is less than 65 years old, he should be disabled. Okay, he should be disabled. So they will make a story and they will confuse you. Okay, palliative care, in that you need to remember the hospice care. Okay, ignore this, ignore this, ignore this, ignore this. Yeah, quality measurement and switch shift model. Just give it a read. Like 1 or 2 questions have been asked in UL. Yeah, this is very important. Very important. Case will be given. They will be like, what do we say? A case will be given and you will need to identify what type of error was made by the physician or the hospital department. Okay, so you have to be thorough with this. Burnout versus fatigue is also very, very high yield. That's it. I think we are done with ethics. Okay. See, again, I told you nothing new. I just tried to give you the case examples where it was necessary. Remaining, nothing new thing. 2022 edition has lots of updates. And yeah, that's it. That's it for ethics. That's it for public health science. So we finished general path, we finished public health science. So guys, I would request you, if we do general form tomorrow, I'm tired today. I won't be able to continue much more. And it's not good if I just go on without doing it moodless. Okay. So I'll cover general farm tomorrow along with we will take a small system tomorrow. I'll tell you in advance what system. Let's go with endocrine. Let me see. No, endocrine is a big system. We'll go with respiratory. Okay. So tomorrow we will go with respiratory. General farm we will complete in 30-40 minutes, and then 2 hours we will go for respiratory. Okay. So for now, I'm just leaving it here. Today nothing was new. It might be a revision for you, those who have done. General path and PHS done. I told you everything that is important. That's it for today's class. If you have any doubt, stay back and or else you can leave. Srushti, stay back, please. I want to talk to you. Pooja, do you have any doubt?
No, I don't have any doubts, but yeah, so just please send the picture of the normal aging page
Yeah, I'll
on
try. I'll
the.
send you. Yeah, I'll send you the
Okay,
aging
thank
one.
you.
I'll send you. Okay. Yeah.
Okay, thank you.
Okay, no
That's
worries.
it.
Yeah. Yeah, Srushti, can you tell me? Did you give the NBME? Another NBME?
No, I haven't. Actually, I was planning to do it tomorrow. I'm at hostel right now, so I'll be going home.
Oh, okay,
So I
okay,
just wanted to finalize the dates and then
okay,
do that.
okay.
Yeah.
No worries, no worries. So just let me know when you do. Okay.
Yeah, I'll be doing it within 1-2 days, most probably. And then
Okay,
I'll
okay.
be
No
going
worries.
home and then doing it.
Okay, okay. No
Yeah.
worries, no worries. Okay, and rest all. How is the preparation going? Like feeling
Uh,
scared?
yeah, actually, I've been doing U World
Mm-hmm.
and I don't know, I'm still not getting that great scores on U World.
Mm-hmm. Okay, but did you try about the biochemistry? Like any improvement in biochemistry after the class? Any improvement in immunology after the class?
Yeah, actually, I studied immunology today as well, and so I did find a few of the questions that I had got wrong in the MBME that
Mm-hmm.
I went through again and did. So maybe in the next MBME that I'll get a better score.
Okay, and even do the questions that you have got incorrect on UWorld. Okay.
Yeah, I added the incorrect. Actually, at the right now, the blocks that I'm doing are the unused ones plus the
Mm-hmm.
incorrect ones.
Okay,
Uh,
okay,
and so it's actually I'm still getting around 55%, So
Mhm.
I'm not sure if I'll be able to cover the whole thing because incorrects are increasing and
Mhm.
incorrects are decreasing, but then I don't know if it's like making much of a difference. You understand what I'm trying to say?
Yeah, yeah, I got it. I got it. Like even doing with the unused and incorrect one, in that also incorrect is increasing and it is piling up, right?
Yeah, that's what.
Yeah, yeah, yeah. It's okay. It's okay. Don't make the decision now. Give 2, 3 NBMEs more. If
Mm,
you are scoring around 190, 200, you are good
mm,
to go for exam.
okay.
Okay. Yeah.
Mm.
Okay. So for now, just solve NBMEs quickly in a span of 3 to 4 days because August is not so far now.
Yeah, yeah, yeah.
Okay.
Mm. Okay.
All right. All right. All right.
Okay. Thank you.
Okay. Bye bye.
Bye bye.